2018 auditor and lead auditor certificate. Guys, the list is endless. So I can assure you that you're in the right hands. You're having the right trainer, and just come with one thing: be ready to learn. I hope we already have our notebooks ready to be able to take some key takeaways today and to be able to learn and take something back to our workplaces. Like I earlier said, the Safety and Health Association Uganda is there to ensure that we create capacity, we do capacity building for all our members. And this is one of its kind, one of the trainings. But be rest assured that in the coming days, in the coming weeks, we're going to have very many of these. If you're not yet a member, please endeavor to be a member, because some of these trainings are just going to be just only going to be given to the members at maybe at free or subsidized cost. But those who are not members, definitely the arrangement will be very, very different. Otherwise, I would like to take this opportunity to welcome you, Edson, at 11:46. That's when we're going to start. I am not sure if the admin, Elizabeth, has already connected you, if you're able to share your screen so that you can say more about yourself. I'm sure I'm not able to complete your entire profile, but then also to be able to hear from you today. Thank you very much, and you're welcome.
Can I be heard, Franklin?
Yes, I'm hearing you, Edson. I think you need to be closer to your microphone so that all the members are able to have a clear, yes.
Okay, thank you so much. Thank you so much for that very wonderful introduction. I want to think that you are right in most of it. I would have loved to have more figures in that introduction, but yes, I had a figure 10, and you know this is a data training, so we would have done better to have figures like age, number of children. I don't know what other figures we can we can quantify about the introduction. But thank you so much, members who have joined. I can see that we have about 42 members on this training, and I am happy to welcome you. My introduction has been made. I am going to be sharing my screen most of the time. I was a bit stuck in traffic, and so I found somewhere to join the call from, and I hope that we'll be able to have a smooth conversation. I'm close to the road. We'll be hearing some background noise, but I hope it won't be able to stop us from proceeding. I am going to switch off my camera at some point to be able to maximize the data quality as I'll be sharing my screen, and I hope that we enjoy. All right, so Franklin, I hope that I can now be heard much better and that I am able to start the training. Is that correct?
So thank you very much, Edson. But before you start, I think there are a few rules. We are not going to interrupt the trainer. Let's all record our questions, but you can easily type your question in the chat, and all these questions are going to be answered. If you need to ask, definitely, but all the questions are going to be allowed at the end of the training. And if you need to ask, then you will raise your hand and you'll be given permission. Otherwise, we can all type our questions in the chat. And Derek, you should be able to get those questions so that we don't miss out any. Otherwise, Edson, you're loud and clear, and I request you to start.
Okay, thank you so much. Kindly confirm that you can see my screen.
Yes, I'm seeing your screen.
All right, thank you so much. Okay, so today we're going to be having a conversation. We're going to be having a discussion. We're going to be having a deep dive into data-enabled safety and health management. And the aim is to be able to empower effective decision-making in our workplaces. You'll observe that we have a number of things to cover. We'll have an introduction into what we're going to be looking at. Then we'll talk about the importance of health and safety management. We'll talk about the role of data, and we'll talk about data collection and analysis. And then we'll go into the types of data for safety and health management and the benefits of data-enabled decision-making. And then we'll have a quick discussion about the tools and technologies, and then the challenges. I have a few case studies. I have one case study and an example to share, and I'll be expecting members to have questions. So we'll answer them at that point, and then we'll have a quick conclusion. I encourage members to share their expectations in the chat room. I encourage members to share questions, and where I have questions or something I need you to participate in, please send your feedback through the chat room. Franklin or any other SHAU leader on call, you help me take those down so that at an opportune time you recite them for my attention. Thank you so much. So we understand that we invited a number of health and safety professionals, practitioners, and interested people here. But I also understand that we are in an environment that is evolving. We have many other people that are interested in health and safety. And so it's important to discuss why health and safety is important itself before we go into elements of data and other things. Okay, so health and safety is important in a number of aspects. Many organizations look at the elements of money, and so for such organizations, health and safety is important to save money, to save costs, operational costs that go into fines and other things. And so it becomes very important for such organizations or such functions in a number of organizations. Health and safety is also important because it's moral that when you go to work, you basically work, improve the organizations you've gone to work in, but also earn a living without injuring yourself, without causing illnesses to yourself. And so it's important that we manage health and safety to protect people, to protect the health of people, to protect communities. And then definitely many countries, I understand we are joined by, we could be joined by people from Kenya, from Tanzania, and across the world. And in all those states, there are health and safety laws. So it's important that, we practice health and safety to be able to be on the good side of the law. All right, but then data-enabled health and safety management. So there's a saying that what you can't measure, you cannot improve. And so how do you manage health and safety without measuring health and safety? How do you measure health and safety without collecting data, without analyzing data? How do you understand your performance? So it's very important that we use data in order to inform our decisions that we take in our workplaces relating to health and safety. So in the course of this discussion, we'll be looking to explore how data can empower effective decision making. Every decision that you want to take as a leader to improve health and safety, you should be able to use some data in those decisions that you make. I don't know if we must have a number of lovers of soccer on the call, just for a light moment. If you've followed the conversations about soccer, you realize that in soccer, there's a lot of data that is used. Even the number of steps that a player makes in the pitch are counted. The number of times he puts the ball on the foot are counted. The places where the player is, the tackles he makes, the number of goals, to mention but a few. So such information is important. In soccer, it's important to inform decisions on how a player likes to play, whether he's fitting, he fits in a certain formation for any manager, whether he can be hired by which teams. So we want to use such kind of standards, such kind of information to be able to improve our workplace health and safety. We want to use data. We want to explore how we can use data in our workplaces to make such decisions that are effective, not just making any decisions. Again, you remember and you've been in safety, it takes leadership to improve safety. You cannot improve safety if you are unable to lead. And it's going to be difficult, or you've seen that it's difficult to lead without using data. If you haven't experienced any challenges, you're going to be able to discover that using data makes your job as a health and safety professional, or even as an employer, whatever capacity you are in on this call, you realize that it's very important to use data in your day-to-day operations. Okay, so we talked about health and safety, but is it the same as is it the same as management of health and safety? Yes, it could be the same, but when you are managing health and safety, you've got to find a few things that you need to measure, okay? The intention of managing health and safety, as according to IOSH 2021, and I want to read it verbally, so that we can be able to speak. There is somebody who is unmute. Kindly mute so that we stop.
He has muted. He has muted. Edson, you can go on. Edson, you're still muted. I'm not sure if that's what you're doing. We can't hear you. Kindly unmute.
Okay, so sorry about that. I think that the system decided to mute me when another person was on mute. I'll go back to the presentation. Confirm that you can hear me.
Yes, Edson, we are hearing you loud and clear.
All right, so I was, again, I wanted to recite the importance of health and safety management, but I reminded us that in management, we're looking at certain things. But for me to be able to, discuss these ones, I want to read verbatim the quote from IOSH 2021. And it goes like this: by protecting your workers, you reduce absences. Think about the words I've underlined. Absences. Are you tracking the number of people, the category of people, the gender, and all the details about the people that are absent, the days on which those people are absent? We want to be thinking about data for every word that I've underlined here. Okay? Health and safety management. You are ensuring that your workplace is more efficient and productive. So oftentimes in health and safety, we think that the efficiency and productivity of an organization is nothing to do with us. We want to think about accidents, trainings, illnesses, everything. But if your company is a construction company, for example, the construction company on a certain project is efficient if it is using less to achieve more, is putting in less resources and achieving more and being more productive. It's being productive if it's doing what it's supposed to be doing, if it's beating the timelines, the milestones are being achieved, and etc. So it's in our interest as health and safety professionals to be able to track these elements of performance, the efficiency. How much are we putting in to hire people? Okay, for example, how much are we putting in to hire consultants? How much are we putting in to hire casual laborers and etc.? We realize that in the future, this information can be used to help us put up what we call a business case for health and safety management. Okay, we proceed. Research shows that workers are more productive in workplaces that are committed to health and safety, reducing downtime. Think about those words, downtime. Okay, you're working in a construction company, you have machines that you're using there. What time? I think I'm getting feedback.
Please kindly mute if you join the call. Brian,
Okay.
please mute.
Franklin, are you able to mute those members from your end? And please confirm if you can hear me.
I'm hearing you. Maybe Elizabeth, are you able to mute people who
when
join?
people join, please mute them as they join. So you need to be able to track the downtime. And these are just a few examples, workers are not working. Maybe the factory is unable to proceed for some reasons. You need to be tracking all these elements. Reducing downtime caused by illnesses, okay, accidents, all these, you need to be tracking them. And we look at, you don't just track the number, you track, there's a lot that you can cover on a simple incident of an illness or an accident, okay? And then money, elements of money. Organizations are going to be able to, give you support if you show them the money element in your health and safety management. If you show them that if we do ABC, we are able to reduce accidents and then negotiate the insurance premiums. I'm just giving you an example from, let me say, 1 billion to 500 million. The organization is going to give you a lot of support, but you need to have data for you to be able to make such decisions, for you to be able to influence such decisions. Okay, so I need to engage the members that are on the call on this element. You can see the things that I've highlighted, and there is more that you can measure in your workplace. Please, in the chat, type for me the things you are measuring, the things you are tracking, you are monitoring and measuring in your workplace. This is just an example, but you can take a minute to type 1 or 2, and then we shall continue. Thank you so much. Okay. This is now exciting. I believe that you have typed a number of things in there. I am unable to see because I am presenting. I will see them later. Keep them coming.
I think people are still typing, Edson.
We don't have any.
I'm seeing lost time injuries. Guys, we need your feedback on this to be able to serve you better, sick leave frequency, and many others. So I think you can check them later, but we kind of have a number.
Perfect. Thank you so much. So you are tracking a number of things. I can see from what people have started typing. But then we want to look at the role of data in health and safety management. We want to look at, after tracking those things that you're tracking, how then are you able to use them to be able to manage health and safety data? Mute that person, please. Okay, valuable insights. Okay, so you've tracked lost time injuries. Let me say you have a number of lost time injuries. If you have recorded 10 in this year, so you have an insight on what type of injuries you have as the majority, for example, or as the most frequent ones, as the most expensive ones. You need to be able to align your insights with either money, the legal issues, the moral issues, the social issues. You need to be able to align your insights to make sense out of them. So you have lost time injuries, okay? Are they costing the organization too much money? Are they affecting the people too much? Are they prohibited by the law so much that the organization is at the risk of being closed out, or subject to enforcement efforts? Or what is it that those insights, what insight are you picking from that data that you are measuring? Okay. All right, so let's look at continual growth. You are tracking first aid injuries, lost time injuries, cases of workplace illnesses, and let me say you have 100 lost time injuries in a given year. You want to set a goal for the next year, or for the next 3 months, or for the next 2 months, or you've gone to a new workplace. You don't know what's happening there. The first thing you're going to do is to ask for their data, health and safety data, for you to be able to pick insights about how the organization is performing in health and safety. And continual growth. If you found that they had 100 lost time injuries in the previous year or before you joined, then what are you going to do? Are you going to have a target of not going above 100, or you're going to reduce the target to maybe not going above 50, or you need to be able to use this data to improve the performance of health and safety management. So you're going to set targets that are improving the growth of your health and safety management system according to the data that you have. I hope that makes sense. If there are any questions, please type them. And Franklin, if they are very pertinent, you'll let me know when I'm done with every slide so that we can address them. Okay, improved program outcomes. If you set out to have a training program and you have a number of training sessions that you have put in your program, you need to be able to understand what you want to achieve from those trainings. And if you have data, it's going to be very easy for you to have clear outcomes out of those programs. Outcomes that can be communicated, that can be evidenced, that can be relied on in order to inform continual growth or to provide valuable insights to the management or to other stakeholders. Optimized operations. All right, so this is very interesting. Sometimes we believe that we are not receiving enough support, or maybe we should get more support, but are we thinking about optimization, using less, achieve more, using what is available to achieve the maximum output that is possible? Okay, have you ever thought about a person who, now this is not in health and safety, okay? Let's get down to something simple. You have a mosquito that is biting you. You have options. You can kill it with your finger, your hands. You can get a pistol and kill it and shoot it. Aha, both of them will deliver results. You'll kill a mosquito. But which one is more optimal? Which one is the easiest option that delivers the maximum results out of it? I bet you want to go for a pistol to kill a mosquito. So if you have data, you're able to make these decisions that optimize operation and save costs for the organization. Prediction of trends. If you have data, you are able to know where the organization is going in terms of health and safety. If you've been receiving near-miss accidents and they are happening in a certain spot every time, maybe let me say every morning or every time it rains, you can be sure that what is going to happen next probably is a serious accident in that spot. But if you don't track this data, you're unable to predict the trends. If accidents have been growing from 1 to 3, 3 to 5, 5 to 6, you're sure that the following period, maybe a month or a day or a week, whatever you're tracking, your accidents, your incidents are going to be much more than what you have. So you need to be able to use this data to secure buy-in from management to support you to reduce those accidents. Actionable insights. This sums up everything. From data, then you can know what should be done. You can know the things that you can focus on, that you can do, that are achievable, that are actionable. You don't just say, okay, we're going to have health and safety training. Okay, so you're going to have health and safety training, but which kind of training? Which kind of training? Are you going to look at ergonomics training? Are you going to look at fire safety? Are you going to look at first aid? So depending on the data that you have, you can pick out elements that are very critical, and you can pick out elements that are important but not critical. You can pick out elements that are relevant, and then you prioritize them depending on their, the data that you have. All right, I hope that the role of data is understood, especially in health and safety management. We'll dwell a lot on this because these preliminary things are the ones that help you to, appreciate data and know where you pick data from and how to use it. Franklin, do we have anything on this subject, on the role of data?
Not really. I'm not seeing any question in the chat, so you can go ahead.
All right. Okay, so we're talking about data in health and safety management. We're talking about data in decision making, but where do we pick the data from? How do we pick the data? Okay, and then how do we use it? How do we analyze it? What do we go through to use this data to be able to, deliver results, to be able to help us make decisions? Okay, so I need people to help me and type in the chat the kind of data that we are picking from the sources that I have indicated here, or the sources that you have. Continue typing the data. Continue typing the data, and we'll be able to discuss those elements either in the Q&A or when we have a session on case study. Okay, so sources of data, incident records. Incident records. I need one person to tell us in the organization what kind of incident records we have. I need another person to tell us the kinds of records they have on inspection, on employee feedback, surveillance, medical records, risk assessment records, maintenance records, and all of these. Please pick one or two and let us know the kind of records that you have. These are helpful for us in data correction, and then we'll look at how we analyze that data later. Franklin, how are we doing in the chat?
We have a few suggestions. Maybe if Martin can unmute and tell us the kind of injuries that they have. Just a brief overview, and then maybe we'll get someone else too. Okay.
All right. Let me mute my microphone.
What I was trying to put, I think what Edson asked for, not really the injuries and the sources of the issues, like
Martin, you're not very clear. Can you get close to your microphone? Yes, yes.
Okay, I was saying that according to the question I understood, Edson was asking for the different data sources that we would use to find out what data, how we are doing in terms of the causes of the injuries. So I'm looking at the leave request sheets, which would definitely tell you why that person is on leave, whether they are sick or not. Then you can look at, if you have an on-site clinic, you can look at what's the patient load and maybe the causes of the sicknesses of that person or the people in there. And let's say how long they spend in there. So that can tell you a bit about what's affecting productivity and what's causing it.
Thank you very much.
Yes, that's good. Can you hear me, Franklin?
Yes, Edson, I'm hearing you.
Yes, thank you so much. I am not able to pick the name, but thank you so much. That's a good contribution. And those are part of medical records. Yes. Do we have a person that can tell us about incident records? What do you record on a given incident? Or what incident records are you keeping? You can unmute.
I think Joel's hand was up. Joel, can you unmute? Okay, if Joel is not, then let me have Dennis Atwine. Can you unmute and answer the question?
Thank you, Franklin. I would like to answer a question on risk assessment records. Currently, we we developed records in terms of the general risk assessment form, whereby we have the date of assessment, the location of work, the assessor's name, and sometimes the review date. We also have the fire risk assessment, of which this one is looking at the assessment of fire hazards, the assessment of fire risks, and the fire evacuation plan. Recently, we added on the manual handling risk assessment, which involves the task description, the list of items to be handled, and the assessment of manual handling risks. Thank you.
Okay, thank you very much. Edson, is that sufficient? I think we can proceed. I'm seeing Ronald's hand is up. Ronald had said questions are going to be later, but Ronald, I think you can unmute and say I'll only allow one person. The rest, please, let's type what we want to say in the chat. Thank you.
Thank you. Mine is not a question. I'm just answering the question about the incident data that we collect. So at my current workplace, we are interested in the category of person who is injured. Is this like an employee, a visitor, or a contractor? The time of the day when it happened, which department or section the accident happened in, and which activity did the accident happen during its implementation. And when we track this, it helps us to decide on where we need to focus our attention. Thank you so much.
Okay, thank you very much, Ronald. I have other incident records in the chat. I think records CAPA log, which records injuries and medical illnesses, incident records, near miss incidents, first aid, MTC, fire incidents, and spillage incidents. So guys, let's keep the answers coming in the chat and allow the trainer to proceed. Thank you.
Thank you so much. Can you hear me?
Yes, I'm hearing
All right. So thank you so much for contributing. I can largely say that we are tracking data. Yes, we understand what we're tracking, and I believe that what we are discussing, but there's something that there's something that didn't come out clearly. We need to do more. If we talk about incident records, this is a source of data. If you have incident records, let me say you record your incidents in an incident report. Okay, so in an incident report there is a lot that you pick on a single sheet of an incident report. There is going to be date. Okay, there's going to be name of a person injured. There's going to be how they are injured. There's going to be the part of the body that is injured. There's going to be the place of the accident, the time of the accident. Guys, this is the data that we need in health and safety. And later you can sum them up, number of accidents, yes. But the data that is going to help us to make decisions as health and safety managers is the deep dive data that you get in that incident. if you have incidents that are happening at a given time, and you have, let me say 70% of your accidents are happening at 4 p.m., you're going to make decisions that are in line with that. Maybe your workers are tired at that time. Maybe they are fatigued. Maybe you need to introduce shifts. And if you go to management and show them that 80% of our incidents are happening at 4, and therefore I am proposing shifts of morning to midday, midday to 5, you're likely to get buy-in. You're likely to have influence that decision to be made. I hope that is coming up clear. And the same goes to inspection records. There's more that is in that record, that report, that you can be able to pick. Employee feedback, surveillance reports, medical records, risk assessment records, maintenance records. There's a lot in those records, guys. Whatever you input in a record, in a report, in that document, be able to measure it, track numbers that you can track from that record. You'll find them useful in the future. Safety committee minutes. When did they happen? Who attended? What was the subject matter of the minute? What were the decisions made? What were the challenges mentioned, and other things? And when you extract reports, for example, you want to show that your system is working. We are holding meetings. Our meetings have been held on Tuesdays, and we've completed 100% of the scheduled meetings, and our members attend on time, and we keep time in the meetings, and etc. So you can see there's a lot in those small things that you can be able to measure. Management review, minute meetings, publications, and etc. Now, publications usually are helpful in secondary data. Usually, if you're going to do benchmarking, you need such things. You need to be able to convince management that maybe 100% of the organizations in our category are using this formula, are using this strategy, are using this process. So we need to adopt it. So in conclusion on this element, everything done at work is a source of H&S data. You need to see how to find something measurable, something trackable, something that you can count in that work that you are doing. The methods that we use to collect the data. Okay, again, I need some input from members, and I need people who have collected this data to tell us. I need a volunteer to describe their incident reporting system so that we can look at elements of data. We can look at how it is helping us to track, to collect data. We can look at how we can use it to collect health and safety data. Franklin, you let me know when you have a hand up on incident reporting. Okay. And I also need a person to describe how they use observations to collect data in their organization. Okay, so I'll give you some time as I discuss surveys. So surveys are usually
Edson, we have a hand up.
Okay, perfect. Perfect. You can proceed.
Hello, this is David. I think on incidents reporting, how we keep our track is through flash report, whereby we record the incidences that has happened immediately after happening. Then that's where we transfer it to the main tracker of the incident report records, whereby within the flash report, we have the time that the incident has happened, the cause of the incident, and who was involved, into the incidents. That is the data that we transfer into the main track. That's all I have about incident reporting records.
Thank you so much. I have a follow-up question. I wanted you to okay, let's say an accident has happened in a certain place, in a certain location at your work. I want to understand how
David, kindly mute.
Sorry.
I want to understand the whole system around how you're going to understand that the accident has happened, how you are going to pick the information from there, and how you are going to report on the information. That's what I'm now not looking at data, just looking at the system so that we understand the system as a data collection method. Just describe the system, how an accident has happened, maybe on the ground floor. How does it get to be known by everybody in the organization?
How I've been doing it, if an accident has happened, the first thing to do is to cordon off the area, and then limit the number of people who are within the area. Maybe the person who has gotten involved, if there is an injury, you first take him off the area of injury, and then you have to do investigation through the people who were there when the accident is happening, those who saw what happened, and if someone who was involved into it can explain what really happened. It's how we collect data from him, and then we collect also, he's the one to tell us the time and what really happened, and then other people who saw can prove, and that's how we've been collecting our information and then include it into the flash report.
Edson, are you around? Are you still
Yes,
on call? Okay.
yes, I am.
Can I have one hand? Just
Yes,
one.
Yes.
Zipporah, Zipporah, can you unmute?
Hi, everyone. Can you hear me?
Yes, you're loud and clear.
Okay, thank you so much. I trust in Uganda, you guys are doing well. I also doing well here in Kenya. Now, how I collect my information concerning accidents or incidents within the workplace is through notification. It's either through a call. Immediately when the accident happens, if I'm not around, they will of course call me or call my colleague and notify us about the accident in the place. Then after that, they will follow us with notification. They will have the notification, then they share with us. And from there now, maybe I can decide, maybe we go to the site and do investigation as we fill in the incident log. That's how we do it. Thank you.
Okay, thank you very much. Solomon, just one last person. The rest, please, let's type in the chat so that we save time.
Franklin, just before Solomon, I have a follow-up question for our Kenyan colleague. The incident log, is it a paper incident log or it's a system-based incident log?
It is a system-based log.
Oh, perfect.
Yeah.
Thank you.
Solomon, kindly unmute and submit, and you'll be the last person. The rest, I'm requesting that we type in the chat.
All right, thank you, Edson and Franklin. I first of all apologize. I extended this link to my colleagues, so we have some of my colleagues from IDI on the call, so I hope that's fine. How we do it here, we have an incident reporting system. So we have a QR code, which is available for all staff on both on our portal repository, but also in the offices. So if there's an incident, and this is also shared on the platforms, on our WhatsApp platforms. So you just scan the QR code, And then you're able to put in the details of the incident, take a picture, attach it, and then upload, and immediately it triggers a notification to myself and to operations team for attention. It is something that we have newly introduced because of the numbers, volume numbers that we are within the institute, but it is working well. So how it captures data, you input the nature of the incident, if it's and it captures different things. So incidents and self-observation and self acts as well. So it captures the diverse aspects. But when it comes to data logging, we're able to export different sheets out of the system. And when those come in, then we're able to determine which ones need to be notified to management. Here, it's a committee that takes charge of OHSE. So we notify within the 24 hours and then establish if there's need to go ahead to do investigations within 7 working days and be able to report back, or if there's need to engage external investigation parties, investigating parties, including police, CMI, and so on and so forth. When it is especially a safeguarding issue, where the safeguarding committee may not necessarily be triggered. There are some of those incidents that require external support or external engagement. So that's how we deal with it here.
Wow, thank you so much. Yes, the colleague from IDI, thank you for sharing the link with your colleagues. You can continue sharing such links. It's important that we share with our colleagues. I love the system that you have. It's what I envisaged that you know, we could rely on to discuss these issues, because we're going to look at a number of systems later, and if you know the name of the system that you're using, you'll probably help us discuss more about it. I have a follow-up question for you. Are you able to extract data from that system into?
Yes.
Okay, perfect. Does the system give you a visual platform to see your performance, to see some curves, graphs? They call
Yeah.
it a dashboard. Does
Yes.
it?
Yes,
Perfect.
it does. Yeah.
Perfect. Perfect. You're running a data-enabled health and safety system as far as your incident reporting is concerned. So members can reach out to you, share your contact in the chat. People can reach out to you to understand how you're doing it, cost implications, and etc. So that they can benchmark. Benchmarking is good. If there are any, I think IDI doesn't have.
Bruce, our system developer, is actually on the call as well.
Perfect, perfect,
Yeah.
perfect. So you can share contacts. Both of you can share contacts. It's important that we have such systems and we discuss with our colleagues how we're doing it. Okay, so we have surveys. If for example you've rolled out a new PPE item and you need to understand how staff are feeling about it, you can send out a survey. It can be online, it can be a paper-based survey, but usually online systems better, but they also have limitations depending on which workplace you are in. You can also do other surveys in health and safety. You go to find out on a specific subject, and you need to be able to track data from the survey. Observations, you can count the number of observations, who is doing the observations, where they are doing them, their findings, and etc. Same with interviews. So on interviews, again, you are able to find out a lot, to collect a lot of data, and data can be qualitative or quantitative. But usually in the systems that we develop, we're talking about, they have a bias towards quantitative data, data that can be counted. But we also have other real-time monitoring systems. There's a colleague on SHAU, for members who do not subscribe to the Safety and Health Association of Uganda. There's a member on SHAU that shares with us air quality data, I think on a weekly or frequently. If that member is on the call, I would like to give you an opportunity to talk about real-time monitoring systems. Yeah, so you type in the chat or raise your hand and Franklin will let us know. But real-time monitoring systems are many. There are different systems that track data in real time. Whatever is happening, they are monitoring and sending data data bits to to some system, some database. And my case study is also based on real-time monitoring systems, and so we'll look at these ones more. But these systems can either measure temperature, they can measure environmental elements usually, but there are also other things that can be measured using real-time monitoring systems. And then document review. If you read through audit records, for example, you are using a method called document review for you to find data. If you read through maintenance reports, you are using document review. So please, every time you read through a document, have a bias towards data. Collect data from that report or document. All right, so these are the methods and those are the sources. And so we want to discuss the process. So having known the sources of data, having known how you can collect the data, then what? Then how do you proceed? Okay. So the first thing that you need to do is to define why you need data. Why you need data. What kind of data do you need? Okay. And where is it going to be? So if in my previous experience, for example, if an investor is doing due diligence, they're going to request for a number of things, and ESG, environmental, social, and governance is part of them. And as part of that, they're going to look at your incident, your health and safety records, your health and safety status. So in that status, they want to see data relating to your accidents, your health and safety risk. And so if you go to do, if you're doing data for that purpose, if you're collecting data for that purpose, you need to understand the kind of data, who is going to receive the reports out of the data, and etc. If you're doing a generic thing, it is fine. You still need to begin by collecting data from the sources using the methods that we have discussed. You realize that the first thing basically is to understand the type of data that you have, and then design the method, the data collection tool. If you're running the kind of IDI, incident reporting system, the data collection tools are inbuilt, only that they have a people element. Somebody has got to go and put in the data. But there are also real-time monitoring systems that are going to observe and send data. If you come from a part of the country or a part of the world where you have an advanced traffic management system, you realize that traffic cameras can pick data and send it to the enforcement agency, and they can take some action. And so if they use such data, nobody is there collecting it. It's a real-time monitoring system collecting data, and then it can be analyzed later and used for purposes of improvement. So you begin collecting data from the sources, and then you realize that you need to clean that data. There's going to be some unnecessary data. Somebody is writing a 30, and maybe they have written 30 and put a comma after 30. See, a system cannot read that as a number. It's going to have some, depending on the system that you've designed. So if you're using paper-based systems, again, somebody, you can ask them for age, and they are going to write their 30 as 30. Others are going to write it in words. Others, instead of putting age, they are going to put male. You have asked for age, they are putting that they are male. So you realize that you need clean data, remove the unnecessary data, have data that can be accepted by your system, and then put that data in the system if it's not been in the system. If it's not in a kind of IDI system, then you need to put the data. Now you need to put it in a system. A system that can analyze the data and analyze it. Analyzing, you're looking for trends, you're looking for patterns, you're looking for numbers, ratios, rates, you're looking for all these things, insights, the things that we discussed previously. You're looking for all these things that can help you make sense, that can help you deliver a point out of that data. So you need to interpret these results and then apply them. Okay? So for example, if you are working in an organization that started with, let me say, 100 people, and you, at that time, you had 10 accidents. Now the workforce has increased to 200, and you have 15 accidents. So somebody is going to try and say, hey, what are you doing as a health and safety professional? Accidents are increasing. Okay? If you have your data, you have analyzed your data properly, you will realize that it is true, our workforce has increased, it is true, our accidents have increased, but think about accident ratios. You might find that the ratio, the number of accidents compared to the number of staff that you are running, or the number of working hours, or whatever it is, you might realize that is actually going down. Or maybe you started with 200 workers. Now you have reduced to 100. But the accident ratio may communicate something different. The accident ratio may not communicate an improvement. So you need to use that data for you to understand clearly what the data is telling you. And then you have got to communicate the findings. Again, I need feedback in the chat. If anybody needs more clarification on this, on data analysis, you can text in the chat, and then we'll see what we can do. Okay, so I believe that you understand the process for data collection, where you collect the data from, how you collect it, and then the process leading to analysis of that data and how the data is actually used. Okay, so it looks as though in our discussion we've been discussing data, sources of data, what kind of data, but we need to do a deep dive into this data, the type of data that we are collecting. Okay, and I want you to pay attention to you know, the everything on this slide. You've got proactive data, and this is data that is about things you are doing to prevent unwanted events, things that you are doing to improve before anything bad happens. They are good things, things like trainings, things like inspections, audits, toolbox talks, ergonomic data, meetings, accident reporting, safe acts, and others. Okay, so there's data about this. They can be sources of data like we saw, okay? but we want to discuss them as types of data. Trainings, what are you tracking on trainings? Are you tracking the trends of, are you tracking the trends in your training? You can see where my cursor is. Are you tracking the trends? How many trainings have we done? How many have we achieved? Are you tracking the time about the trainings? Are you doing the trainings on schedule? If in your health and safety management plan, you had said in the first week we shall do this training, in the second month we shall do this training, and are you tracking the trainings with respect to the time, the date, so that you know in setting of your goals, you realize that you need to be doing things either on time, in certain spaces, and etc. So you're going to track the time the trainings have been conducted, the attendance of those trainings. You're going to track the quality of the trainings. You're going to track, and then later you'll analyze the trends that you're taking. You can even track the location where the training was taking place, because if you have different workplaces, they might require different trainings, maybe different languages, different elements, and etc. So you need to be tracking also where. Inspections, audits, toolbox talks, ergonomic data, and all these things. So if for example, we're talking about ergonomic data, you need to be tracking things to do with the body, what part of the body, what, you know, and so on and so forth. So in many organizations, data about ergonomics is overlooked, but it's what helps us to even inform decisions on what kind of PPE, what size of PPE, the acceptance of such PPE, and so on and so forth. Accident reporting, yes. Are the accidents being reported? Now, sometimes accident reporting seems to be a reactive data. But if you have accidents that are not being reported, you are surely not doing enough. Just that you don't have accidents is not enough. You need to be having accidents that are reported and reported on time. You need to have accident records that show you what part of the body is being injured. In my previous experience, I had people looking for PPE, and some of them wanted to dress as though they are going to, what's the most dangerous place? As though they are going to, it used to be Mars, but recently it changed to the Titan. People as though they were going to explore the Titanic, the remains of the Titanic. You know what I mean? They want to go padded and etc. And so when you check in your incident reports, you're looking for the using previous accidents, and you're trying to see the parts of the body that have been injured previously, or that pose a risk, or that people have complained about. And you don't see the parts that they are trying to protect. And so what will you tell management? Management is interested in saving money. What are you going to tell them? You want to buy a full body armor, and you are going to dig. Just giving an example, they are definitely not going to give you that kind of resource. All right, so you need to collect data on all these proactive events or activities or processes, and that data should relate to the time, to the geographical location, to the body, the parts of the body, the impact on the body, and etc. The people that were involved, okay? The impact that they have on either the environment, the money, or the people themselves. You need to be able to track that data. it is not enough to say that we need a training because health and safety, we must do trainings. You must say we need this training because a number of people are being injured and that injury is costing us money, or maybe the environment is suffering from this kind of waste disposal and etc. And so we need to train our people. If you approach it like that, management is likely to give you more support. And you also feel better because you know what you are doing. And you also appreciate your efforts and the efforts of your team because you have data that show what you are doing, how you're doing it, where you are going, and where you're coming from. All right, reactive data. The things that
Edison,
have, yes, please.
before you proceed, someone said kindly clarify more on ergonomic data and how to track it.
Okay, fine. Thank you so much for that. So ergonomics is the study of how you can fit the workplace, the workplace to the needs of the worker. So for you to fit the workplace to the needs of the worker, and not vice versa, because that's where the argument is. Are you going to ask the worker to fit in the workplace, or you're going to modify the workplace to fit in the worker? An example, if you have a lame person, a person that is physically challenged, are you going to ask them to stand yet they can't, or you're going to find a way of lifting them to the nth floor, or maybe you're going to readjust and allocate them space on the ground floor? So this is what ergonomics is about, and ergonomic data can be anything about a human body, about a person. You need to understand the size, for example, the foot size of all your workers. Just giving an example, because you're going to buy them footwear, you need to understand their height. You need to understand all that information about the human body is important. If you're going to buy them PPE, you need to understand, because the PPE is going to be more acceptable if it is fitting, if it is suitable for them. Okay, that's an example about the person. But also, you need ergonomic data about the workplace itself, the environmental considerations, the light intensity, the temperature, the humidity, and all these other things. And then you're going to see how to adjust them to fit the needs of your workplace, of your workers. You're going to need data about the height of tables, the size of tables, the height of the chairs, the maximum height they can adjust to. You need to understand, if you have a very tall person in your workplace and you have chairs that can only seat short people, that worker is going to be an issue. But if you have data that has already told you so, even when the HR is hiring, you will require them to share that data, and then you will petition or you requisition management to make arrangements for that worker before the worker comes. Okay. I used to work in an environment where people had to wear crash helmets, and you have ladies, you have people from Uganda. There are some parts of Uganda where people have are blessed to have bigger brains and so bigger faces. And then there are parts of the world. You have a person that is coming, let me say, from I don't know. I think previously I've seen people from Japan, and their size is very brilliant people, but the size of the head is a bit reduced. And so you have to plan for all these. You have to be able to understand the ergonomics, the information about them. And so you match the workplace, you provide things that are appropriate for them, you adjust the workplace accordingly. That is what ergonomic data is. And it can be proactive, can also be reactive. Okay? When you are measuring light intensity, the act of measuring is good, but I mean, you are measuring data that has already, you're looking at data that has already, that is already in the workplace. So it might be a reactive in some way. Accidents, injuries, illnesses, and other things. These are reactive. You need to understand the data again, according to time, location, their impact on the body, on the money, on the environment, on the people, and then trends. Okay, near miss incidents and safe acts, environmental monitoring, health surveillance, medical examination. Medical examination, this one is purely reactive all the time. You're checking the contaminants in the body, in a person's body. You're trying to see how much they have swallowed, how much they have inhaled, how much of those contaminants are in their body. Employee feedback can be reactive, but the act of collecting it is proactive. Reactive in a way that they are going to share either complaints, things they don't like, and etc. They have already gone back. But the act of collecting such information in itself is proactive. But this data is important for you. If you analyze its trends, you can be able to make a business case for health and safety improvement. Cases of enforcement action. You need to track these. Every time they come to your workplace and stop you and fine you and do ABC as a health and safety officer, you need this data. It's going to help you in the future if you propose certain improvements and you are being challenged, and you need to justify the proposals. This data is important. And if you're in a position where you make decisions, pertinent decisions, then this data also is helpful for you to be able to decide which options to take, which decision to make among many. All right, so I don't know, do we have any question on this? It looks we have spent more time on it, but I know why. It's very important. Check for me in the chat if you have any questions.
Not really. We just have contributions from people, and those who have time, you can go through. But otherwise, I don't see any question in the chat.
Perfect. Thank you so much. Okay, so there are a number of benefits of using data to inform your decision making, and I will just rush through these ones. I see we are chasing time. But accountability to you and to your team members, to the entire organization, you can be able to account to them. You can be able to set objectives and work towards those objectives and account to the people what you have achieved and what you are yet to achieve. You've got results. If you are measuring, then you have results. And usually when you are measuring, you are motivated. If you are tracking data, you are motivated. Every improvement is a motivation for you. And so it's important. Again, personal growth is very important in your workplace. Whenever you see that you have taken, let me say, 100 days without a lost time incident, the next time you take 200, it's personal growth. Personal growth may not necessarily mean money, academics, and etc. Your capacity can inform personal growth and can motivate you. So please track data. If you are going to attend an interview or so, again, you can show accountability in that perspective. You've been able to control accidents from this to this in your previous organization. Just giving an example. Or if you want to show the performance of your department, can say in our department, we set out as a goal to achieve 0 fatalities at the beginning of the year. We are very happy that it is now September and we have 0 fatalities. And even more, we have no lost time accident. So if you speak like that, you're going to be speaking authoritatively, you're going to have good leadership skills, and I believe that everybody is going to be happy with you at your workplace. Another benefit of data-driven decision making is transparency. What are you doing? What are you using the money for? What are you using your time for? What are you being fair in your decisions? Okay, you are saying that this category of people cannot do ABC, but are you do you have data to justify that? Okay, are people likely to believe you? If you have data, people are likely to believe you. You are speaking the truth. Accuracy, you can be able to track whether whatever you are speaking about is a speculation or you are using accurate information with clarity. Okay, so these generic benefits of health and safety of data enabled decision making, and we look at those that are specific to health and safety. Efficiency, you could find that you're using a lot and achieving little, but every organization needs you to use available resources, or to use less resources, or to reduce the cost in your operation while improving your quality and the speed at which you deliver your results. So you need to be able to use data for you to determine how you can be efficient. Okay, without that you can't. If you know, in health and safety we have what we call as low as reasonably practicable. You have to look for decisions or things to do that reduce the risk, okay, but also do not increase the cost too much that the organization cannot afford. So you need to keep it somewhere there where it is reasonable to do so, because it reduces also the risk reasonably, and it is not so expensive. That's the kind of argument or discussion you need to be having, but you need to use data. You cannot have such discussions or arguments if you don't have data. Goal alignment, health and safety function, health and safety department, health and safety team. You must make sure that you align your goals to the entire organization's strategy. You cannot have health and safety goals that are not aligned to the other strategies. If, for example, your organization has a goal on reducing costs for some reason, you need to have goals that are aligned. How do you reduce costs as health and safety? You need to do the trainings, yes, but how are you going to reduce costs in there? Maybe you want to strike strategic partnerships with groups like SHAU, like the Kenyan Association, and others, like Gonjola Uganda, the organization that I head, and others, to be able to cut costs in delivering those trainings, for example. But also, you need to look at the timing of those trainings. You have a goal on productivity. You cannot be keeping people in trainings the whole day, the whole week, the whole month, yet you have a goal on productivity. You need to be able to improve health and safety while aligning your strategy, your goals to the entire organization. And you need data to show that you're aligning this, to show that you have goals that are aligned to the goals of the organization. If you do that by aligning your goals as health and safety function or team or department to the corporate strategic goals and the business unit goals and the team goals and individual goals, then you will be successful in what you're doing. Now, there is this quote that I find very interesting and very relevant for most organizations that are quote unquote struggling with a good safety culture. Learn to admit your mistakes before someone exaggerates the story. Okay, you'll hear 100 people died in a fire in this organization. 100 people died in a fire. Okay, if you don't know how many people were injured in your fire, are you going to be able to defend such a story in the news? You definitely can't. You'll hear 1,000 people in this organization are involved in accidents per year. And you're like, what? Well, if you do not know the kind of data about accidents in your organization, you can't be able to defend such a story. Okay, so you need to be able to collect data, use data in your decision making to be able to, avoid such things, but also to own up. It's a good value to own up, to be responsible for the things that have not gone well in your organization. But you can only do that if you have data. You were supposed to do 10 trainings, you have achieved only 5. Well, that's not a bad figure, but you should know so that you can say, no, we set out to do 10 and we have achieved 5. Well, we admit that we have not done well, but among the 5, people have appreciated ABC and we've been getting 100% attendance and etc. You have data to justify good things, but also to admit those that have not gone well. In terms of health and safety, and you must remember that most organizations are using, health and safety, or if you want to achieve a good business case for health and safety, you have to show us how they are able to save money, how you are able to save money by doing what you are doing. If you have data, you can predict the future. You can say accidents are increasing. If we don't do this, we're going to lose this money. And so we need to train people. We need to employ a consultant. We need to strike these kinds of strategic partnerships for us to be able to prevent that money. Now I'm putting a business case in general terms. Root causes. There is no way you can determine the root causes of a series of accidents or a series of events without data. You need data. You need to find out where did it happen, what time, ABC, all that information, so that you can start analyzing those things and finding out root causes. Areas of improvement, SMART goals and objectives. I want to talk about SMART goals and objectives a little more because I know that this training was sparked by a request from a member about setting SMART health and safety objectives. So we're going to spend a little more time on this, but we also benefit from data by making effective risk mitigation strategies, effective things that deliver the intended result. Delivering intended results, we go back to objectives. You must have set goals. You must have determined what you want to achieve for you to say that you are actually driving or operating an effective strategy. Improved employee safety. Employees, they love it when you show them what they are achieving. In one workplace, I was in a construction company. I had introduced a reward system, and some people were supposed to observe others, and then I give them something depending on their performance at the end of the week. And it was very helpful for workers to, on a toolbox talk, to know how they performed the previous day. Very, very encouraging. So if you use data and you inform the stakeholders, in this case, the employees, they're going to feel much involved, and you'll have an improved employee safety culture. Increased productivity. What did you What do you intend to achieve as an organization? And if we use data, we are tracking the performance both of the organization entirely and also health and safety. And if there are some shortfalls, we are able to state the shortfalls, and we are able to state the things we want to do, the mitigation strategies, and what they are going to achieve. And if you do that, you have put up a business case for health and safety. It's not important to go to your employer and ask them for a certain, for a budget, yes, and say our budget for health and safety is this. We are going to do trainings, buy this, go for a trip, do this, you know. And where is the money element? You need to be able to tell the employer that by doing this training, by employing a consultant, by doing this survey, by doing this walk around tour, by doing these meetings, because they are going to be spending money on those elements, you need to tell them that by doing them, we are able to reduce the accidents by this percentage, and therefore reduce the premiums we are paying to insurance or the money we are paying in compensation by this amount. And because we agreed that we are going to be accountable and transparent, you will follow that goal to the, you'll follow it and make sure that you achieve it and report on it. And trust me, the organization is going to be very excited about your performance, and you as an employee are also going to be very excited about what you are doing. Let's talk about SMART goals and objectives. SMART is just merely an acronym stating that you must set specific goals. Specific. What are you going to exactly tell me? What are you going to do? We are going to do training. Is that specific? No, it's not specific. We are going to do first aid trainings. Okay, measurable. How many people do you want to attend? How often? That you are measuring. Okay, achievable. If you say we're going to do 1,000 first aid trainings, is that achievable in 1 month? Maybe operations will close and everybody will go for a first aid training. It's not achievable. You need to set goals that are achievable. Okay. SMART objectives. You need to set goals that are time bound. The goals you are setting, do they have a time boundary? Are they time tracked? And then relevant. How is first aid relevant to health and safety? Okay, you need to be able to explain that. How are social events, going to the beach, going to Miami and etc., how are they relevant to health and safety? Yes, they are relevant because we can do team building, we can build the culture, etc. You must be able to explain that. Okay, so we set our goals from, allow me to take you back a little bit. We set our goals from these elements of data. Trainings, how many trainings do you want to do? What type of trainings? When are they supposed to be done according to time, and where? Space. Okay. Inspections, the same thing. Audits, how many audits are you going to do? How many toolbox talks? You can set a goal around here that we want to achieve. We want to do toolbox talks every day, okay, of the week, or maybe every Wednesday of the week. And then you definitely, they are relevant. We'll be talking about a number of topics, and you set your goals according to that, and you put a time limit. The time limit between maybe now and next, and maybe for this quarter or for this year. Usually we set annual goals, but you can break them down. So if you say that that's what you want to do for this year, maybe the following year, you want to do what we call continual improvement. You were doing a toolbox talk every Thursday. This time, please improve and do a toolbox talk daily. Do a toolbox talk daily. That's what we call continual improvement. So you are using data again to improve the goals that you are setting, and so on and so forth. Okay, do we have a question on the benefits of data-driven decision making in health and safety management? Check for me in the chat, please.
Not really, Edson.
All right. So, guys, we are coming close to the end. I know that we should be having our lunch break, but we're coming to the end. So, our gentleman from IDI, tools and technologies, there is a number of tools that are used to collect data. Okay, so they can pick data, or somebody can put in the data in the tool, in the system, and then that system is going to be able to analyze the data either on your instruction or naturally, and then it's going to display a visual format. Some systems are programmable. You can program it to do certain things, or it is just made to do that. And so they display that data, and you can see the trends of the accidents, of the trainings. You can see the training that is lagging behind, the training that has not been conducted. You can see all these things. You will need to have begun with a plan, a safety management plan that informs the things you must do for proactive measurements, but for reactive, you need to have a system that picks that information and then puts people that pick the information, put it in the system, and then you can be able to observe the information. There are a number of them. I'm not going to look at specific ones, but I have interacted with Microsoft Power BI, also programmable into what you want. I've also interacted with Salesforce, and it's also programmable. You can use it to do what you want, but there are many other things. Some deal with big data, some can only deal with simple data. We have MS Access, one of the easiest and most accessible to all the people that use Microsoft Office. It's more or less, it's a database. You can put in data, and then you can have some form of dashboards. I've never used MS Access, but I know that it is one of those programs that if you understand quickly, you can be able to make use of it. But there are simple programs. I understand that not all organizations can afford all these crazy systems and technologies, but you can just stick to MS Excel. Excel, everybody has an Excel on their computer, or at least everybody who uses Gmail, you have Google Sheets. So you can collect the data and put it in Excel and keep your data in Excel even when the organization has not sponsored a system. Collect accidents, indicate accident in one column, the details of the accident, where it has happened, the time, the persons involved, the part of the body injured, the cost implications, and etc. And the time you have closed out the root cause analysis. And at the end of the day, you can be able to analyze this data. People will be telling you, but what are you doing as health and safety people? And you analyze your data and you provide the reports. Or you might be requesting for certain things, or you might be trying to do making a certain decision. You analyze your data and it informs that decision. You see the trends and you see how you are performing on different aspects. G Suite. G Suite is a package that's available on for all Google users, and you can even subscribe, you can even pay for it, but it is available for free to some extent. Through GForms, Google Forms, you can design a simple system that collects data, a form. If you see a paper form, that is filled, that's what you can decide in the computer. And GFORMS can provide that some form of dashboard, some form of display of data. It's a bit limited, but yes, they can also be programmed. And so they show you the trends, they show you the patterns, they show you the numbers, and you can be able to use this information for you to inform your decision making. This data can be extracted into Google Sheets or into Excel for analysis, for deeper analysis. So there's a number of things, but guys, you need to cut your coat according to your cloth. You cannot go for expensive things if you can't afford them. You need to start with what you can afford and maybe put up a business case for an improvement, an improved system, a system that can run health and safety and other activities. Okay. Do we have a question on this, or do we have the IDI gentleman to tell us if or the system they are using, or if it is one of these?
Yeah. I think Bruce, it would be fair enough to allow Bruce to be the one to mention.
Sure, thank you. Bruce, is he unable to unmute? All right. All right. I think we can move on.
I think he's off.
He's off. It's fine. It's fine.
Yeah, but it should be Power BI. Yeah.
Power BI. Perfect. Yes. So Power BI is one of those tools that can be programmed to be able to, deliver data driven decisions. Okay, so there are some challenges, definitely challenges to do with data privacy. People will provide data, but how is it private? The quality of data, the technological limitations, and the cost implications. Sometimes you have data from different sources. Sometimes you need skilled labor, you need professionals that can be able to analyze the data and communicate results, but also communicating results to some people that are not technical may be a challenge. So you need to be able to work around this environment to see how you can improve. But part of what you can do to improve is to have proper data governance, some policies around data, train your staff, ensure ethical use of data. Don't collect information and start using it in an ethical manner. It's even illegal. And then you start with the available resources. Like we've seen, start with MS Excel, start with G Suites. Do something that you can show, and then you can be able to convince your management to give you more, to do more with you. Okay. All right. So I have just a simple case study here. I was running a project to reduce distance traveled daily by workers, and I want to show you how you can use different forms of data for you to inform decisions. So this is how it started. If you can look at this window here, we have a worker in their normal operation, they cover 93 kilometers a day. Okay, this is a lot, and accidents were high. And you as a health and safety person, maybe you're focused on reducing accidents by training, by what, but you have forgotten that there can be key elements that also increase significantly the accidents that are happening. And so I set out to reduce this distance to 50 kilometers per hour to be able to manage the accidents. I have some feedback. I hope you still can hear me. And the data that I required, I want to show you how important different forms of data can be helpful. Look at this. These are GPS coordinates. I just need to know where a worker is and this data is being provided per second. And I need also to know the accident records and the cost of those accidents and the operational costs, etc. Because these are the ones that help me to put up a business case. I'm going to say, let's adopt this formula to reduce the distance from 93 to 50 and to reduce the accidents from this to this, to reduce the cost of accidents and the cost of operation. And then I show data on all of those. So if you look at this chart here, the eye chart of distance traveled daily, you can see that using the data that I pick from coordinates. From coordinates, I'm able to tell the distance. And so I use this data to chart out the distance covered. You can see that on average, many people are covering 93, but there are outliers. There are people that cover a lot of distance, over 300 kilometers in a day. So many people, and well, not so many, but some people. And so I need to investigate these ones specifically. What were they doing? Why were they doing that? And etc. And so you find that, again, when you analyze, you might find that these people who covered a lot of distance, they are the ones that account for the highest accident records. And so you say that, I think my method is working, but there is something wrong with those people who are outliers, who are doing extremely dangerous things. Okay, so through a series of things, first you go through a fishbone diagram, a cause and effect diagram, to understand exactly what is causing these people to cover a lot of distance, and then we try to find out some reasons. I mean, there's a lot that happens between the other slide and this one. I'm only summarizing parts of this project, and I'm able to find that maybe one of them was route planning. Some people are not planning, and I try to outline conformance to route planning and correctness of route plan, and I find that there is actually a correlation, that if there is a route plan that is correct and that they conform to it, maybe there is a positive correlation between those two, and through a series of things, I am able to reduce this distance by proposing new methods. I'm only picking data elements here. I'm able to show that, okay, our distance can be reduced if we do A, B, C, and I run a pilot. Okay, so here I chart data before the pilot. You can be able to see in this chart where I'm putting my cursor that before the pilot, the distance is a bit high. It's 93 kilometers per day, and the maximum people are actually covering about, some people are actually covering up to 300. And when I run my pilot, I am able to reduce distance to somewhere around 30 kilometers, an average of around 30 kilometers per day. And after doing this, I also track the accident. But because accidents cannot be tracked in a pilot, it's a bit of bias. You need some long period of time. I track the operational costs. And when I track operational costs here, I see that before the pilot, the costs are well a bit, they are increasing because people are continuing to cover a lot of distance, getting so many accidents and etc. After the pilot, the cost starts going down, the cost of operation. And so from this, I am able to adjust to convince management, adopt my new method of doing things, a method that reduces accidents, a method that reduces operational costs. Because you can see, again, from this map here, you can, this came out of what we call a spaghetti diagram. You can realize that people are only covering 30 kilometers a day from 90 in a pilot, which means after rollout, maybe they could cover 50 or 40. And if you are able to run programs that are data enabled, that move in this kind of format, you have a lot to say using data. And so management is most likely to accept the things that you do, because those decisions are informed by data. There are simple things that we can track in our day-to-day life, like traffic fatalities in Uganda, for example. This report was picked from Uganda Police Force annual crime reports that ran from 2010 to 2020. You could see that they were increasing, the accidents were increasing. The motorcycles were responsible for the most of the increase, but the pedestrians were responsible for the highest number, but you can see they are going down. So if you want to make decisions, for example, your organization is using motorcycles and now you want them to start using shared means, maybe public means or something, or maybe buy them cars, you can use this information to make to influence such decisions. If you are looking for who to prioritize in your training, you can use this. You have cyclists responsible for the lowest and also decreasing, and motorcyclists were responsible for slightly lower but increasing. So if you don't do anything for them, they are shooting and pedestrians are going down. So you could focus your training now on motorcyclists. So you can see that data has got a lot that helps you to do in your decision making. There's a lot that could be shared, but I want to pause here and see if we have any pertinent questions that we can answer briefly, and then we'll be able to break. Franklin, guide me on questions.
Okay.
If there are any questions.
Okay, thank you very much, Edson. Wow, 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 wow. Thank you and thank you and thank you again. I think it has been such a wonderful engagement. Yes, I see claps coming. Keep on clapping, guys. Reaction, those who enjoyed, those who learned something. We need to appreciate the trainer for the day. For me, the key points is collect all your data for both proactive and reactive data, analyze it, and be able to report with evidence. Very, very important. It increases efficiency, speed, and also reduces the operational costs, but also the incident costs. Very, very important. Right now, we are in a Q&A session. So I'm going to receive about 5 questions. We started late. We're supposed to stop at 13:30, but then you realize that we started late. So I'm giving those extra minutes so that we are able to, those who have burning questions, kindly raise your hand. And those who can, please type in the chat, okay? Someone says, can we hint on data and early use in I'm not sure what that is. Kindly hint on data use and what is AL used in HSE management? I'm not sure. Martin, maybe you can unmute and clarify your question because it doesn't seem very clear to me. And those that have questions, kindly raise your hand. We're going to only pick 5 questions. Martin?
Do you have
Hi, Franklin. Are you able to
Yes,
hear me?
please.
It's
Yes, I'm
AI,
hearing
not
you.
AL. I tried to put it in small
AI.
letters there. I wanted to ask Edson, thank you very much for the graphics. Quite eye-opening to see the the level of contribution to the corrections. Yeah, the red zone is definitely justifying my fear for the bike stories. But yeah, I wanted to understand. It's the time I did a simulation. Are you able to hear me?
Yes, proceed.
Yes, thank you, Edson. There's a time I did a simulation on let's say that the what's it called? Cost comparison, cost benefit comparison of traveling in the night and traveling during day using one of the AI tools. And it was very interesting what it highlighted. I think I'll try to get that file and share it here in the chat. I wanted to highlight how could you be able to hint on how we are can be able to use that very data, but also maybe try to integrate it with AI tools and manage our our different mechanisms, better decision making.
I'm not sure I'm understanding exactly what you mean. I pick cost benefit analysis for traveling at night and traveling during the day. Yes, there are definitely obvious costs of traveling during the day and obvious costs of traveling during the night. And you would be doing yourself a disservice if you don't look at the health and safety costs of accidents. If an accident happens during the day and if it happens during the night, what are the costs involved? How do they compare? What are the losses that what are even the number of accidents that happen in the night and during the day? Yes, and other things. So it's about picking data on everything that happens in travel in the night and everything that happens in travel in the day, and you compare those ones in their different categories. You might also need to interview people and pick their perceptions, to interview drivers. Even when accidents are not happening, maybe there is a level of risk that is attached, but just accidents are not happening. So you could also have to interview people and then analyze the data. Now, on the use of artificial intelligence tools are very many, and they do a lot of things. I don't think I have even the competence to discuss artificial intelligence on this call, but yes, there are simple tools like Nova on our phones. Everybody who operates an Android phone, I think, has an artificial intelligence app in there. But there are also other systems, bigger systems, that rely on artificial intelligence to do analysis, to do reporting, and other things. So yes, you definitely can use artificial intelligence to do data analysis or to pick insights in data or to do that kind of research. I hope that I tried to cast a wider net to be able to see if I can help you, because the question didn't seem very specific for me. Franklin, do we have any other?
Maybe I'm not seeing any other question.
All right, thank you so much.
Yes, Edson, I just wanted to encourage our listeners to kindly go to the chat, fill in our feedback form. It just takes about 2 to 3 minutes to help us serve you better. I realized that I didn't open or unmute or do what, but Edson, maybe you can give your concluding remarks, as I also turn on my video to kind of say, I'm not sure if we have the president. Maybe, are you still presenting? Can I allow you to conclude? Then I call the president or someone to give a vote of thanks, and then we close.
Sure. I just wanted to, to say one thing about Peter Drucker's quote, and I want you to, if you can't carry anything from the training, carry this. If you can't measure it, you can't improve it. Please, if you are not measuring anything at work, I don't think that you are improving it. So again, try as much as possible to measure everything that you are doing at work, and through that way you are able to improve your health and safety performance. All right, thank you so much again. This is from me. I thank you for attending and participating. It's been a very fairly interactive session, and I appreciate your participation and your attendance and for keeping within the guidelines of the training. Thank you so much from this side, and I wish you the best on your journey to data-driven decision making. Thank you.
Yes, thank you very much. Thank you very much again, Edson, for your time. And I believe that the members on this call are going to make better decisions that are data-based. Like I had said, I will invite Edgar our president to give a vote of thanks and so that we are able to close. Okay, Edgar, are you able to hear
Okay.
me?
Can you hear me?
Yes, Edgar, loud and clear.
Okay, thank you very much, Franklin, for moderating this session. Thank you very much, Edison, for being there for Shao. Edison was the finance person during the interim committee, and to find that he's still there to help us and come and be part of the mentorship for Shao to help in sharing knowledge, we really appreciate. This is very, very informative. As told you, it is evidence-based research, evidence-based decision-making. Without evidence, you are not going to convince management to do anything. So you have to come up with data collection as a way of ensuring that you know what you're doing so that you are not misinformed. It is very good. It was very good session, and we look forward for more and more engagements with you, Edison. Thank you very much for loving Shao and being able to come and talk to the professionals and to the organizing team. I don't know how much to thank you because this has been a work in progress that we have been wanting to come up with these sessions. And now that they have started, it's very important. And thank you very much, the organizing team, which is led by communication, Rachel, Derek, and Elizabeth and the others. Thank you very much for this. I think to the listeners and to those who managed to come and spend your time, these are like 2 hours. We don't take it for granted. Thank you. And thank you for being good listeners and not leaving. Even we have encroached in your lunchtime, but you have been there. Thank you very much. I think that is it from me. Thank you very much, and God bless you. Let's take what we have learned and go and make difference in our workplaces. Thank you.
Well, thank you very much, President. I would like to remind you that you only need 100,000 to join the Safety Health Association Uganda, but also do not forget to follow us on our social media platform. You can follow us on LinkedIn, on Twitter, on Facebook, but most importantly, become a member. Let's change Uganda. Let's make Uganda a better place. Let's make decisions that are informed. I'm Franklin Mwesije, Vice President, and I wish you a very good day and thanks for coming.